I have the pleasure of introducing our two speakers, Shana Peiffer and Michelle Martinez. Shana is the Director of Child Protection for Save the Children, where she leads the strategic planning, new business, and technical collaborations to improve the protection for the most vulnerable children. She has worked with Save the Children for the past 12 years in both country offices and in headquarters, but always in child protection. And she began her experience in humanitarian response before moving into child protection work in development and fragile state contexts. She is a sought-after technical expert in addressing sexual and gender-based violence and measuring child protection outcomes, and brings that technical lens to these discussions on ethical issues with adolescents. Michelle Martinez is a second-year PhD candidate with the Department of Population, Family, and Reproductive Health at Johns Hopkins Bloomberg School of Public Health. She's worked for numerous years in academic research and implementation studies with experience across various fields. And over the last 3 years, she's contributed to projects led by the 21st Century Cities Initiative, PATH, and the Bill and Melinda Gates Institute for Population and Reproductive Health. Above all, she's focused on adolescent health in her work with the Global Early Adolescent Study, through which she became involved with the project that's being presented today. So with that, I will hand it over to Shana to give a little bit of background, and from there to Michelle.
Thanks so much, Jen. And really, thank you to the very young adolescent community of practice for inviting us. We are really happy to be part of this conversation. The NGO scan that we're going to discuss today is part of a larger scope of work related to ethics and adolescence. And so we wanted to share just an overview of the timeline to give it a bit more context and help indicate where we hope this might be going in the future. So based on some early discussions with the Global Early Adolescent Study, or GEAS, and the Save the Children team, we began identifying ethical issues arising from that research. A panel discussion was hosted by GEAS at a pre-conference event at the ICFP in Rwanda back in November 2018. And initial exploration of the issues kind of sparked interest by quite a few of us in further work together. In May 2019, WHO and GEAS convened an interagency meeting in Geneva, where an agenda related to the adolescence and ethics issues was developed. All of this was acknowledged and built on the work driven by WHO. They had recently published their ethical considerations for SRH research, as well as UNICEF's leadership with ethical research in children, or their ERIC resource. Subsequent plans were for WHO to convene 3 regional consultations in India, Kenya, and Peru. And like many of you, those plans were derailed due to the COVID shutdown. We were able, or WHO was able, to host the first consultation in India in December 2019. And really, it was a really great conversation. We gathered diverse insights from a range of stakeholders. The present scan, kind of moving forward now, the present scan is a collaboration between Save the Children and the GEAS, and done in conjunction with WHO, to identify what organizations, and especially large multinational organizations, do to provide staff training and guidance when faced with ethical issues and concerns. It was really important for us to understand the process of addressing ethical issues, not just from the perspective of developing appropriate research protocols to help mitigate or anticipate ethical issues, but also what happens in the field during the actual data collection process, and how do organizations navigate them in real time. An important feature of this work from the very beginning was the emphasis of this discussion to be centered on both researchers and practitioners. While we tend to think of ethics specifically related to research and IRBs, a lot of the ethical issues that are faced by researchers in the field are also similar to those who are actually implementing program and delivering services. And ideally, our outputs are relevant for both. And so in this discussion that we have, and you'll see in the findings and in the discussion that we'll have, we really do welcome that kind of dual perspective. And reflection and on experiences both from researchers as well as practitioners. Very happy now to hand it over to Michelle, who will walk us through the detailed findings, and then both of us will help, happy to answer any questions and listen to your feedback afterwards. Over to you, Michelle.
Great, thank you so much, Shana and Jen, as well, for the introductions and for getting this work kicked off and started this morning. I think we can proceed to the next slide, which is the title slide. So my name is Michelle Martinez, and it's a pleasure to be speaking here with everyone today, and I will be presenting our findings regarding ethics in research and programming with adolescents, and particularly those perspectives from NGOs. Next slide. You can, thank you. So first we have an outline of the presentation. So we'll just quickly review the purpose of the scan once more, how it was done, and we'll spend quite a bit of time with the key findings, and we'll close it out with some recommendations and where future work might be heading. So next slide. Great. So the purpose and approach really took form to understand the ethical issues that are faced by providers as well as researchers, as Shana mentioned, and the guidance that is provided by international non-governmental organizations, as well as donor organizations who work with adolescents. And so in doing so, we held interviews with key informants from each of these groups. So first, we conducted interviews with 17 different organizations, amongst whom were primarily program managers in some capacity, and then we discussed with 3 donor organizations. Next slide. So our first question was fairly broad, and it was wondering, what are the main ethical issues that were raised by people in your organization? And there's a set that came up fairly consistently across the groups, and the first was that adolescents truly understand their assent and consent to research and programming alike. And tied into that is their understanding of their choices. And particularly, this includes their refusal to participate. Next, we ran into this issue of balancing an organization's needs for protection, as well as those needs of participating youth to be protected. And this is a rub that I think is pretty consistent throughout the ethics process and research process for sure. And then this sense of knowing when and how to make referrals was reiterated across the board as an ethical issue in working with youth. And tied into that as well are the obligations of NGOs to actually follow up throughout the referral process, after the referral process, and where that line really stands. Next slide, please. So our next question then got into what actual guidance and training is provided to field staff. And we came across some issues in terms of language that we use, which often is used interchangeably, and that is child safeguarding versus child protection. And so essentially all groups and organizations have a child safeguarding protocol, which essentially involves the level of responsibility that an organization has to do no harm onto the children with whom they work. Child protection protocols are a little more varied for sure, and that has to do more so with the activities that an organization may take to respond to the circumstances of abuse or neglect or violence that children are living in. So I wanted to make that delineation fairly clear before proceeding. Next slide, please. So we then turned from our protocols towards guidance and training that organizations provide for their staff. And there's 2 types of trainings essentially. And one set is guidance and training that is developed by organizations themselves in order to guide staff. The second set is focused on the work of institutional review boards, or IRBs, and the protocols and requirements from there that generally govern research in particular. And oftentimes it's also a combination of those factors as well. So in terms of training, ethical issues tend to be discussed fairly broadly at first. And from there, they hone in oftentimes on adolescents as a special population who have unique needs and requirements. So while Broader ethical issues may cover things like basic principles of ethical research, such as respect for persons or beneficence or justice. Those needs that we're looking at for adolescents consider things like navigating parental consent and needing to be cognizant of special adolescent populations, such as emancipated youth. Also wanting to, make sure that we're treating them as autonomous persons, and more so than those without agency. So these are kind of the ways that they're teased apart during trainings. And in terms of the methods and approaches that are taken during training, often they're developed by organizations individually using vignettes or role plays and discussions as pretty common strategies to elicit some reactions from the field staff. And otherwise, they use, sometimes even in combination, established online trainings such as CITI, which is an online ethics training that is available to many, but not all field staff sometimes. And finally, I wanted to bring up an issue that we'll be discussing in more depth, which is that international NGOs do tend to depend on local implementation partners for staff training, for those who are implementing the program or research or doing the data collection. So there is a bit of a distinction that needs to be made between the INGOs and their local implementing partners. Next slide, please. And in terms of discussing the ethics in guidance and training, we came to this evolving understanding of ethics, and that is that these attitudes and approaches are changing. And first, we're seeing ethical treatment as being seen as a right increasingly. There is a greater acknowledgement of adolescents as a vulnerable group. There is an increasing awareness that adolescents themselves have autonomy rights, and that makes it critical to involve them more explicitly in research and programming. And there's also an increasing priority to train field staff on actually managing ethical issues that involve adolescents in practice, and to make sure that they have the appropriate responses whenever issues arise right then and right there. Next slide. And the theme that I think will be woven throughout this presentation as well is that ethics is really a continuous process in research and programming, and it should involve the following principles: that it is flexible, that it involves regular protocol updates, that ethical considerations are adapted to the context that you're working in, communities or countries. Also, that there's a balance of power between INGOs and implementing partners. And somewhat connected to that is that there's a longer term perspective on partnerships. And these were some of the themes that were echoed as principles throughout the interviews that I held. Next slide. So then we get into a little bit more of the nitty gritty and how do these protocols work in practice? And this came into form through discussing INGOs who work with implementing partner organizations. So all INGOs do have their own internal protocols and trainings. However, when issues arise in the field, first responses of the identified problems tend to be taken by the implementing partners themselves, and INGOs often provide the support or backstopping, but don't necessarily overstep any sort of balance of power. And the processes for having this partnership between INGOs and partner organizations includes regular updates. It includes a principle where the sharing of incidents often depends on severity of incident. And then if an incident is shared, an INGO's response may depend on the case details, on the context, on the donors that are involved, and also on the type of research and services that are being provided or data being collected. And so these are really important nuances to take into account. Now, in the field, there are strategies for eliciting any issues that arise. One is debriefing, and that may be in the form of group sessions, that may be in the form of individual debriefs, that may come over WhatsApp messaging with other field staff. And that's a way to regularly check in as to what's happening in the field. You can also document issues, which is, I think, a fairly common standard practice. Also in coding, particularly in qualitative work, there's codes that you can apply to when distress is identified amongst participants. And then finally, they discuss concepts of data reviews, right? Reviewing data at key points in the research and programming process to kind of take stock of what's been happening so far. Next slide. And now, so how referrals are approached, and this is going to take up a little bit of our time here because referrals came up across every interview that I had, and they were really critical kind of rubbing point that we're still contending with. So the first step that came across was referrals start before research or programming even begins. So they start with the mapping of local services. There's an identification of really relying on the context knowledge and networks that implementing partners have. So INGOs aren't necessarily doing it themselves, right? There's also an importance of identifying trusted community representatives as and to have referral sources. And then finally, there's this kind of shared understanding that the strategies are constantly evolving, even as a research project is possibly ongoing. But you would like to have as much done beforehand and preempted as possible. The next step is in training, and that training focuses on strengthening the understanding of adolescents as a unique age group, on discussing the unique needs and rights of adolescents, and again, including that right to refuse referrals as well. And finally, in order to encourage that referrals are really actually given and taken seriously by field staff, and then providing them with the resources and ways of making referrals that are truly achievable. Next. So in the third step, during research and programming, we see that services are really just a mix of local providers, NGOs, and government agencies as well. And the delivery strategies are pretty diverse. So it could be a list given to all participants, pre or post survey or research or programming, it could be a tear-off paper, or they could be pointed referrals given at a point of contact. I do want to make a very specific note here though, and bring your attention to some respondents believing and indicating that researchers are in fact exempt from country-specific, legally mandated reporting obligations in many instances. And this came about in considering that field staff and researchers are not necessarily medical doctors or psychiatrists or psychologists in any form. And I would just suggest that we kind of take a step back with this and kind of carefully explore the issues that this brings up. First, of a legal obligation to report that may or may not exist, but also a moral obligation to report if this is warranting concern, and maybe in terms of finding other ways to fulfill that moral obligation. Oftentimes, and again, this is so nuanced, oftentimes reporting though does put a adolescent at more risk. Next slide. And this brings us to those challenges with making referrals. And there are barriers to following up on referrals that were identified in every interview, I believe, where referral follow-up is not done, it's not required, it's not possible, such as in cases of confidentiality where servicers can't share information, or it's even a risk to the youth working in particular contexts, which this makes effectiveness hard to determine, again, without this follow-up. And this actually yields some pretty significant impacts on researchers and implementers as well. A number of interviewees discussed how their own field staff, especially working in longitudinal work, could identify if something had changed or something had not changed in an adolescent's life or in their family's life. And that can be pretty demoralizing in some cases to them. And ultimately, this final challenge was in navigating this level of organizational responsibility and capacity that is at times or oftentimes fairly unclear. And this is again that rub between safeguarding and protection that I had discussed earlier that continues to be a pretty significant theme throughout this process. Next. Next, we identified how laws may in fact constrain best practices in different communities or contexts or countries. And so we may be limited oftentimes by parental consent requirements, and in programming, particularly with service consent laws as well. And this turns as well towards reporting of confidential behaviors that maybe we are concerned about and want to refer for, but reporting on those behaviors may increase risk to adolescents. So reporting on behaviors like illegal substance use, undocumented immigration, and even in context of gender-based violence as well. And an interesting example that was brought up here, and it's not a law, but cultural practices, in fact, may sanction the behaviors that field staff themselves oppose. So if we're looking in context of corporal punishment, where is that line crossing into violence? And is it appropriate to make referrals for instances of corporal punishment that are acceptable in a community? Those are just some of the ways that we've identified some kind of things that are at odds. Next. And particularly interesting, I think, to maybe this COP of people interested in very young adolescents are some issues that are not often considered. So adolescence is indeed a very diverse age group. Protocols and research itself tends to focus on older adolescents. Next, we do come up to consider whether adolescents at different age levels have different protection needs and decision-making autonomy. I think there's an understanding that they probably likely do, and many of the interviewees indicated that they would consider conceptually the differences between an 11-year-old and a 17-year-old having issues is quite different. And then finally, there's sometimes little consideration of special adolescent populations like those listed here. Sometimes the research focuses explicitly on one of those groups, but we need to kind of consider how to rope those special adolescent populations maybe into more of our research more generally. Next slide. And there were some suggested strategies to handle these issues. So first is a creative parental consent approaches. So if you're researching or programming around sensitive subjects like child marriage, gender-based violence within relationships, you can frame the parental consent around adolescents' relationships and then reiterate your own availability for questions or concerns. You can also design research that is sensitive to a topic to preempt issues. So you can sample distinct enumeration areas or households, and you can change or remove questions for younger adolescents. Next. And so I have an example here that I think came out as really critical in weaving ethical considerations throughout the research. So the violence against children strategy involves engaging stakeholders and constituents to adapt the survey. They use same-sex interviewers. They actually sample separate enumeration areas for males and females. And then within that, they sufficiently space apart participating households with one participant per household. And then finally, they have primary, secondary, and tertiary levels of referrals depending on the severity. And these are in themselves responsive to special populations. And finally, they do involve social workers actually as part of the research as well. Next. And so we'll kind of round it out here with suggestions for the future that were asks of the interviewees themselves. So first is kind of reframing our approach to ethics. And again, it's ethics being woven throughout researching and programming, looking for more youth voice and recognition of autonomy, overcoming this sense of silence and culture of silence and speaking to young people, having more flexibility and understanding from stakeholders, and working within context to reconcile laws with best practices, training on context-specific policy and practice pitfalls, relying on implementing partners, of course, to inform local context. Next slide. And in terms of suggestions for the future for organizations, for staff, we want to encourage internal conversations to make ethics conversations a lot less taboo. And this can help support and foster trust and equality with partners as well. In terms of referrals, we would recommend considering organization-provided services, such as involving psychosocial support employees. Understandably, this involves a lot more money and a lot more time to do so. But we do need to continue grappling with this question of where that line of responsibility lies. Next. And there was suggestions in terms of creating universal standards of some kind. And I will say that there's two approaches that were kind of two camps here. So the first is more universalized standards that avoid leaving issues up to individual discretion, which means that they are a little bit more prescriptive. An alternative is to use this set of resources as a resource center to just remain non-prescriptive and have backstopping whenever issues arise. And so priorities for that guidance would be to define some key principles, understand and integrate the best practices to meld ethical practice and research, to provide clear guidance and principles for implementers and researchers themselves, and to modify protocols based on the skills and capacities of partners. Next. Now we have suggestions for funders as well. In a number of conversations, issues with funders came up, and the first is to advocate for more appropriate funding and timelines. And this would involve advocating for the centralization of ethics throughout research, from sampling to referrals to follow-ups, right, along every step in the pathway. And there's some ways of conceptualizing this approach that I have in italics there. But we'd also like to consider future research needs. So that is understanding the experiences of adolescents in research, and then also balancing the safeguarding of adolescents while we're also developing relationships with them. Now, these types of research needs require funding, require longer term follow-up, and do also require a greater value of those reflections in academia and academic circles. Next. And finally, just because I wanted to really round out this discussion and make sure that we considered their voices, we did speak to donors, and they came out as their training was specified for internal staff. They aim to support grantees for whatever needs are identified in partner assessments. They had a capacity building approach to this as well, and they tend to frame their support as trust building and not as punishing when issues arise, as well as, aiming to not micromanage. But again, these perceptions of responsibility and kind of where the buck stops really do vary. And this arises questions around suspending funding and who that harms most. And they asked for more certainty around ethical issues and emphasis on the importance of ethics and openness. Next slide. So now we've come to the conclusions, and ultimately, the current state of ethics in research and programming with adolescents is quite fragmented. And there is a very clear need for affirming both safeguarding and protection, as well as those clear definitions for where organizational responsibility lies in order to assure the highest ethical standards. And ultimately, we see that there would be value for universal guidance when working with adolescents. Next. So I'd just like to acknowledge and give a huge thank you to Dr. Blum with the GEAS, the Global Early Adolescent Study, who was so supportive throughout this process, as well as Shana Peiffer as well with SAVE. You guys have just been fantastic. Next. And I could not have done this presentation or given you any of this information without all of the fantastic organizations that we spoke with. Next. And I have a slide here for discussions and questions, and thank you all for your time.
Thank you so much, Michelle, and thanks to Shana as well for that great background and introduction on this work. Without any further ado, I'll just open up the floor to those who might have questions.
I would just give one example of what you were talking about, Michelle, in terms of donors and donor support. The Oak Foundation, which is based in Geneva, recently announced a small grant application to their grantees for capacity building, organizational capacity building around child protection and child safeguarding. These are grants under $20,000, but it really is aimed at fostering just some of the kinds of internal structures that you were talking about. And I recently saw that and was impressed as it relates to what you were talking about. Back to you.
Yeah, I think that donors are starting to really catch up with the needs for extra funds to do this work. And there on one of my earlier slides about recommendations for funders, there was in italics a comment that said we can't do more with less. Essentially, research and programmers cannot assure ethics at every step of the way with less money, with less funds and time, oftentimes, and the timings that are set aside in IRB protocols. It's hard to do more with less, and it's great to see that donors are starting to take this, I think, much more seriously and are starting to accept that financial responsibility as well for making sure that that work can be done properly. So thanks for bringing that up, Bob. And Shana, I don't know if you want to jump in as well with any comments about maybe more programming specific issues or topics at all, or anyone else?
Michelle, I see there's a question. I know you probably can't see it in the chat box. I know when you're kind of screen sharing it. So I can help also with navigating some of those questions. So one was whether or not you ran across any formal evaluations of ethics in research with youth.
Yes, I opened the chat box. I can see it now. Thank you. So running across formal evaluations. So I focused on looking at the gray literature largely. So I would not imagine that there are very many formal evaluations, because gathering data about ethical conduct and the lack thereof in research, or on referrals and what happens after that, is very difficult. And oftentimes, I think, organizations understandably might not want to share or widely publish that information, except for on their websites, and not necessarily through formalized evaluation processes. I think that there are increasingly teams that are set up within organizations, monitoring, evaluation, accountability, learning meal structures that are looking more towards ethical processes. So I think that in the future, in the horizons, we'll see more of those, but not very many, I think, formal evaluations, and particularly, I'm not so sure amongst the younger groups as well. And then I see a question from Alice about examining the ethics about what gets researched and programmed. I think that's a little bit of where I was going with those future research needs, right? Looking a little bit more upstream and looking towards what gets funded. I think that makes a huge difference in the information that we have out there and kind of our perceptions of what youth are, who they are. And this also speaks to this culture of silence around speaking to youth, because there's so many more barriers and there's a lot more red tape in speaking to youth and speaking to younger adolescents as well. Because they're sort of in this gray area of child versus adolescent. There's not a lot out there yet. And, understanding their reflections and their values and what research is and how we can engage them more properly as individuals with agency is I think where hopefully the next kind of era of research is going. I see more questions. Okay.
Yeah, there's a few. I don't know if Alice, if there was anything you wanted to clarify about your question, or.
Okay, well, sorry, I've got a bit of a frog in my throat. Thanks so much. It's been really brilliant to have this presentation. Fantastic to be talking about it. And this is a bit beyond, as you were saying, it's maybe next steps, but I'm just thinking about the context of the sex and reproductive health and rights of girls and young women in particular, and to take, for example, the research and work that's being done on PrEP, pre-exposure prophylaxis, and this includes the dapivirine ring. And unfortunately, what happens is that on the one hand, of course, everybody is extremely anxious to reduce the amount of HIV being acquired by young women. But on the other hand, this is often with the consequence that young women are basically being implicitly encouraged and supported to head for deceit and having to hide their medication. I remember at the launch of the dapivirine ring, the young woman was saying, you know, I can use this, hiding it from my partner without him knowing that I have this in place. And, you know, there's been research done from Zambia, I think, which explicitly explores the assumption of girls and young women that actually having to be secret and having to be duplicitous is just a given, an assumption in relationships. And there isn't concomitant funding for building trust, for mutually respectful relationships and reducing intimate partner violence. So, I mean, I think in a sense, you know, everything you were discussing was really important, but I've kind of felt that the locus of the discussion was more around the relationship between the international NGO, the implementing partner, and the adolescents. Whereas I wonder whether also we need to bring ourselves into the frame in thinking about, well, what are we actually focusing the funding on, the research on? You know, are we just focusing on the biomedical techno fix, or also are we also thinking about what is actually ultimately what we want for young people in terms of meaningful, respectful relationships?
I think I can only echo your comment here, and thank you for them, Alice, I believe, because I think this is a constant rub in public health kind of overall, is making that more temporary or easy to reach biomedical fix, or really going for those upstream factors and working towards fixing those. And I think that this is where we're hoping to head increasingly in doing ethical research and programming. You know, what does it mean then to be ethical, and what does it mean for us to pursue ethical research insofar as we can and we can advocate for? So thank you.
Yeah, really great point. There's a couple questions too, Michelle, about sort of doing more non-traditional research in the sense that it's online or by phone, especially during these COVID times.
Yeah, there was actually one instance where I discussed this with an interviewee, and we discussed how they've had to change and get a little more creative in their researching with adolescents during this time. And they've had to adapt their survey instruments. They've had to adapt their modalities for data collection. So this specific instance, they were discussing doing phone data collection. So it came up to the issue of, you know, if we're asking sensitive questions, can we ask them when they're at home, if they're surrounded by, you know, family members or persons in their lives who maybe they don't want to answer those questions around? So then if they're not at home, where are they going to be when they're asked these questions? Are they still feeling safe enough to answer these? And also it comes to the very real issue of incentives for participation, because now we're asking for their time, we're asking for their internet data or their phone minutes, and whether and how we can make sure that those incentives are provided to make sure that they can actually participate in their research without it costing them, right? We're asking for a lot from them already, so how do we do this without costing them? And so those were just some of the issues that came up in doing data collection that's, you know, in the era of COVID. But I think that a lot of organizations have had to contend with this. And in a programming example that came up that's just jumped to the front of my mind, there was an instance where programmers and mentors who were local mentors, they were in the community that they were living, were so engaged with the research and hoping to keep it going when operations kind of shut down, especially at the beginning of COVID, that they lobbied with the government agencies in the local area themselves to continue some programming and data collection with households in the area with whom they were already working. But the organization was a little concerned because, well, we're not explicitly involved in what they're doing, but they're wanting to share this data with us that they're gathering. But at the same time, we can't in good conscience encourage them to continue doing this research or doing this programming because, you know, it's COVID. And so there's this like huge impetus of people who want to be doing the work. And then there's a very real reality that I think we're all, still in the midst of, where that can't always happen. So, oh, I see comments and questions.
Yeah. I really like Courtney's comment about maybe thinking about minimum standards. And then Marjorie made a comment as well about, or asked a question about where we can report ethical breaches. So we have just a few minutes left. Maybe we can take those last couple questions, Michelle?
Yeah, absolutely. So I'll start then with, Marjorie's at least. So I know that in conversations with donors are starting to encourage that organizations report to them, right, when ethical issues arise, and their responses again also depend on severity and the like. Whether or not there are international, WHO based reporting mechanisms, I'm not entirely sure, because I don't think that there is as much of a universal standard in doing that reporting. In my kind of preliminary scan of the gray literature, I didn't find that. I may have missed it, but again, that also should point to a little bit how these things can get buried fairly easily. So if it is out there, and I hope it is, I didn't come across it. So oftentimes it's pretty project or organization specific, I think, in terms of reporting. And again, where our recommendation is looking for the future, whether it's universal guidance, whether it's a resource center, maybe that is a place where we can have a hub of reporting, capacities. And then to Courtney's question as well, I think, okay, right, the cost. I really appreciate this set of sort of minimal guidance and standards. So we at least have a baseline of where we can expect, funding to start with donors. I think that's a very, very actionable idea. So we'll certainly take that into account, I think, moving forward, because it's hard to be on the same page with your donors, with the IRBs, with the organization, with your own field staff, and then also with the people with whom you're doing research. To get all of those pieces on the same page from the beginning and to set those expectations from a very clear space has, I think, been the hardest kind of way to move forward so far. So I think, a set of minimal standards in terms of funding, but again, in terms of how your organization works, in terms of, what participants are expecting, would be very helpful. And another piece of this idea of minimum standards is also to do very due diligence to the fact that there are oftentimes many groups working within a single community. And this was brought up by a few interviewees who mentioned, another organization may be providing all of these incentives or all of these things that, would maybe not be what we're providing. So they go from one research project to another expecting things that are very different. So having sort of at least this minimum set of standards, I think, is a fantastic way to approach moving forward. So thank you. And thank you all for your questions and comments and this link. I'm excited.
Thanks so much, Michelle. Thanks again to you and to Shana for a really rich presentation. I just want to let everyone know that we will, in addition to circulating the slides, we'll make sure to include contact information if you have additional questions or thoughts that you want to share as this work is sort of moved ahead and packaged up. So this is not the end of the conversation.